Good morning, everyone. We will just start in a few minutes and we'll give it time for everyone to join us. Oh, great start. Hello, everyone. Let's turn on our microphones. Welcome to the Health Tourism Markets Working Towards the Thaw. My name is Romilly Douglas and I'll be your moderator. I'm pleased to introduce today's speakers, Irving Stackpole and László Puczkó. Irving is the president of Stackpole Associates, a strategy, marketing and research firm founded in 1991. Irving is a mentor for the European Institute for Innovation in Health and EU program to stimulate healthcare entrepreneurship. He edited Medical Tourism Marketing, the first book on the subject. He is the co-author with László of the Marketing Handbook in Health Tourism. László graduated as an economics specialist specializing in tourism and holds a PhD on the environmental impacts of tourism from Budapest University of Economics. He is a certified management consultant and a past president of the Association of Tourism Consultants in Hungary, CEO and co-founder of Health Tourism Worldwide. Both Irving and László have with decades of experience in health tourism and wellness. Before I hand the microphone over to László, I have a few housekeeping items to cover about this presentation. First, today's webinar is being recorded and will be made available by email to all participants after the webinar for further review and sharing. We'd love to hear from you during today's presentation and we'll be answering the questions at the end of the session. If you have a question for our speakers, please feel free to send it through the Ask a Question tab at the bottom of your control panel. And if your question is for a specific speaker, please let us know. If we don't get to your question during today's webinar, we'll be sure to follow up with it afterwards. So without any further ado, I'd like to kick things off by welcoming László. Thank you.
Thank you very much, and let me welcome everybody, also from my behalf, and thank you for taking your time and participating in this webinar, and I should say very good evening as well, since I know that we have colleagues from Asia, so it's evening time, and some others, especially Irving, it's very early morning hours, so we have really a proper global presence today. I will kick off with a couple of pointers on the wellness tourism side, because we agreed that we share the discussion, and some of which will be focusing on medical tourism, some of which will be focusing on wellness tourism, and I'm doing the wellness part. So just a couple of critical issues in the field. I think it's time to have a quick overview of what's what, and we understand that health tourism is the kind of travel where the primary motivation is physical, mental, spiritual health. And under that, we have the medical tourism and wellness tourism as we understand it. I think it's very useful that we have just a kickoff terminology, since it gives us the framework under which we are discussing these points. I think the hot topic here is what exactly is going to happen to wellness tourism in that sense after or during the COVID-19, since I don't think we can say that we are over. To get into the really middle of it, let me share with you how we understand this business. Since every single trip contributes to the traveler's well-being one way or another, family visits, business visits, cultural visits, as well as medical wellness visits, we have two major groups of impacts we need to look at and motivations, and one is which is nothing to do directly with wellness or medical, and that's what you see on the left-hand side when we have well-being improving options, such as self-gifting, which is, I think, going to be a very important part of the motivation set as we speak. And also the other one would be the healthy options. And obviously we have the medical side and the wellness side. But it's all very academic and all very structured. Let me translate it to you to a very different level. So we have, in medical tourism, we have the need to go. Many medical tourists don't actually want to travel. They need to because of accessibility, because of price, because of urgency, because of the state of health. That motivation may not be changed as significantly by the COVID situation or the fear of issues after the COVID situation than in the wellness tourism side, where people want to travel. They don't need to travel, they want to travel because of spiritual reasons, because of their very own personal wellness reasons. This is their very own choice. That again may or may not be, again, it's not a very definite answer here, may not be influenced that much by the COVID situation, because people might say, you know what, I really deserve to have a wellness trip. I absolutely want to go to a wellness trip. And the other side of the motivation spectrum might be the happy to. So travelers will be very happy to receive additional services or even information about how they can make that make their trip a little bit more well-being orientated, or whichever service can contribute to their well-being. If you look into this kind of distribution of needs and wants, we might look into our offers in a very different way, because what is needed or what is wanted or what is just being just happy to have, obviously has a major impact on how people might consider traveling in the first place. We shouldn't also forget that, especially nowadays, people will look into the health span and probably less so the lifespan, which the World Health Organization has been suggesting for many years that we should look into health span. So however long we are living, that should be healthy, or that should be more on more focused on the well-being of our lives. This is probably a very, very hot issue as we speak, since people really look into their well-being and health because they are really concerned. I think and also a very hot issue for any one of us who participate and listen to this discussion, that on the experiences model, people wanted to have a lot of satisfaction, a good amount of surprise, but they wouldn't do a lot of sacrifice. Post-COVID, it's very likely that people will need to do a lot of sacrifice, being worried that they might have a quarantine situation, they might be restricted to do certain things, they might have longer waiting times. So in the motivation of guests, the sacrifice, surprise and satisfaction mix is changing significantly. And again, how you promote your services would need to take that into consideration. And yes, it's a silly little example of how might people react that wearing a mask and what kind of masks you might want. And of course, it's not a very factual one, but the desperation that finally I want to do something which I enjoy which could be a wellness activity or wellness trip, very much likely is going to be in the forefront of what people want to do. It's a little bit of a complicated chart, but I'll guide you through. The COVID situation has an impact on the distance we travel, the brands we consume or look for, the desire of what to do, and the location, what to visit. And obviously the parameters go short distance, long distance, well-known, unknown brands, bucket listed as such as I really have wanted to visit this place and this is not the time because I don't know what I can do next or ever, or you want to be anything that is tried and proven, or you want to do something which is popular and busy or hidden or secluded, not quite knowing what exactly that means. And don't forget, this can change from destination to destination. So at some place you might want to have an unknown brand and it should be close. For other people, it should be a far destination which is popular and busy because you trust the protocols of a brand, how they keep the sanitation all in place. So just consider next time when you do any kind of promotion or service development, how you think your market is located itself in this chart in terms of distance, brands, desire, and location. Because some might say, I want to have anything which is hidden and secluded, I don't want to be surrounded by a lot of people. But at the same time, I want to have a brand in that hidden and secluded situation, which is well known, which certainly exists. So that's a nice challenge. And when you have your own decision, just let us know, because happy to hear it. And also, when we talk about wellness as such, we have four major options here, which is wellnessification, when the whole service provision is wellnessified. Sorry about the stupid word, but that's what it is. So you have a scan, and we can help you with that, for example, of what exactly is recommended in terms of wellnessify of gastronomy, accommodation, room service, treatments. You might want to have just a illusion, which is something that looks good or sounds good, and it's related to wellness, but we all know that it's not exactly something that we can trust. You can also think about entertainment, which is an entertainment infused into wellness activities that actually can have fun, since most of the spa wellness treatments are offered or have been offered in a temple-like environment where you shouldn't be talking, we shouldn't have chatting or enjoying yourself in a traditional way, but you have to be very confined and very quiet. Or you may want to be a Welliment, which is the leader in your own business based on your very, very highly focused service provision, like a retreat. Again, it's up to you to decide. A wellness tuna in sunflower oil, what would that be? Would it be a illusion, or it would be something else? But it's or just about entertainment. But we know that this is happening everywhere and does not help with the businesses that are really focusing on wellness provision. And one of my favorite and controversial examples is what we call Perineum Sunning. You will always have a large number of new innovative, called innovative treatment and solutions that becomes very popular, and of course social media helps a lot. Bloggers, vloggers all talk about it. We don't quite know what the impacts of these are, but they become a very fashionable thing. And yes, before you ask, there is something like that, and is being recommended, and it is what it suggests. Still, it may not have a long shelf life. Still, issues like this, such as in Japan, when you do have a proven record of what hot lava may do to you psychologically and physically, may be valued again, because people would like to know the evidence. So I would like you to remember that you need to give some sort of details or evidence of what you are suggesting in wellness, especially after the COVID situation, because people want to know that this is safe or just a joke, to be quite honest. So as a summary, because I need to pass it on to Irving to talk about medical tourism, we have been talking about user experiences for quite some time. But if you don't mind, I think we should shift to well-being experiences, which is WX, and more like responsible well-being experiences of whatever we are doing, what impact it may have on the host environment and host situation, and how those experiences may contribute to our well-being. We might even have another webinar on this topic, because that really is something which is new, and we would be very happy to talk to you about. So remember, we need to have stories, we need to have reliable stories, we need to have evidence, we need to have unique well-being propositions, not sales propositions, make this recognize this difference, but value propositions, why that is good for me, because I may need to reconsider all of my trips, so I need to understand why that is valuable to me, what is just being sold to me. And we also understand that service providers, just like yourselves, or planners or organizations, would need to be mentored of how this is going to be done and how we can translate all these great ideas and new models into operations. We're happy to tell you that such mentoring activity will follow up this webinar from end of September onwards, so watch this space. We're very happy to tell you how that is going to be laid out. And health tourism is a luxury. We believe that it's now becoming a necessary luxury, not just a luxury itself, but a necessary luxury because of the health scares, because of the mental well-being challenges that we are observing. So more people will be looking for these services and these value propositions that you're doing. Just calling your attention to the handbook that we have been written with Irving, and we're very happily launching it in just 2 weeks' time. So watch your mailbox, because we will be happy to tell you all about it. And should you want to talk to me about the wellness side or any other matter, feel free to contact me via these channels. And should you want to have more information about all the intelligence that we developed, feel free to visit our website, which is very suggestive, since it's healthisoverwhelmed.life, just even with the domain suggesting how important life and well-being really is. This is time to pass the microphone and the camera to Irving, and I'm more than happy to receive your questions now or later. Thank you very much.
Thank you, László. Welcome, Irving.
Thank you, László, for, as always, an excellent presentation. And I'm going to ask my colleague, can you see my screen all right? Can you see my screen? All right. So we're off to a good start. We are very pleased that you all made the commitment to register and to show up. We're particularly pleased that so many of our colleagues from India, Southeast Asia, and other Eastern countries have joined us. So good evening and thank you. This is an extraordinarily important topic. I know these are extraordinary times. We've never been through a period such as this. So I want to thank you all and send my sincere wishes that and hope that all of you are well and surviving, and that some of you are even thriving. As was said at the beginning, or László indicated, we hope that you'll sign up to take a look at our new book. We've added quite a bit of detail useful case studies and the marketing basics for health and medical and dental tourism, which I trust you'll find useful. My intent today is to talk about how medical tourism in particular, but the markets overlap, as László pointed out, talk about external factors, public health response to the pandemic, talk about demand both in travel and psychologically, and talk about supply and capacity and the path to recovery. As László went through his presentation, I was struck with the array of options for segmenting demand, segmenting our markets. And this becomes tremendously important and hardly an academic exercise, terribly important for one of the strategic options that providers, health and medical and dental, have in dealing with the pandemic. So in the health tourism markets, there are segments to the markets that are critical to understanding how we can respond, how we can work toward the thaw. The first end of the markets is what I refer to as high volume, low unit value side of the markets. In the health, dental, and medical areas, dental, cosmetic, orthopedic, and all the way over to cardiac or high complex cancer treatments, for example. These are low volume, high unit value elements or segments to the markets for health and medical tourism. These markets are frozen. Any of these markets that rely on cross-border travel are frozen. There are emerging markets and demand that's less distance specific, and we'll talk about those. And there are certain procedures that, as László alluded to, although I don't think I want to do any perineum sunning right now, there are hedonistic or those I want it ends of the market that providers, which historically have focused on the low volume, more complex types of surgeries, more complex types of procedures. There are some of those service lines which providers may want to consider. So in these markets, what's critical for consumers is the stability, the perception of stability in the destination. The second factor, of course, is access. Can I get there? A third factor is the economics. Can I afford it? Am I still employed in the current environment? Another issue is capacity. Are the hospitals, are the providers, are the dental clinics, are the cosmetic service providers, are they open to provide? Are they providing the types of services I'm interested in? And then the final issue is reputation and brand, which in a pandemic is critically important. And we're still evaluating the impacts of reputation and brand at a national and destination and even provider level, as we are, 7 months into this situation. Well, certainly from a travel perspective, you have to look at the number of commercial airline flights around the world, and this is fairly recent data from Flight Radar 24, which shows a comparison of 2019 versus 2020. And you can see the profound and remarkable drop-off in the number of commercial airline flights around the world. This, of course, is what we refer to as a frozen market. Now, some people you've seen in the popular press some discussions about recovery in the travel markets, and we can see a very gradual return or recovery of commercial airline flights since its absolute plummet in March, to where in July they were beginning to come back, but of course they're still nowhere near where they had been prior to the crash in March. How will the travel market recover? How will, therefore, the health tourism, the medical tourism, health tourism markets recover? Well, looking at the traditional models, one can look at the re-engagement or the recovery of the travel market parallel with the recovery of, or similar to the recovery of economics, the gross domestic product and other major economic indicators. And what we were predicting back in March when László and I held our first webinar on this topic, we weren't predicting a V-shaped return or a U-shaped return, as many political pundits and wishful thinkers were suggesting. We were suggesting a Nike swoosh. So in March, we suggested that there would be three likely recovery paths for travel activity, and that these recovery paths would be based on things like the coordinated response to the pandemic, the ability of travel carriers to operate economically, the ability of nations to coordinate their response, because it doesn't matter if I can fly from Portugal if there's the destination I want to get to doesn't allow me or doesn't permit me or presents obstacles for me to arrive at my destination. That doesn't do me any good if my TAP airline flights leaves Lisbon if I've got nowhere to go. Well, here's very recent data that shows the actual economic recovery that shows in Europe how the recovery has been halting. It has been up and down, and it certainly looks very similar to the curve we were predicting back in March. And that's because of the peculiar lack of synchronicity in response to the pandemic around the world. Hotspots continue to emerge. Countries work very, very hard at allaying or mitigating the effects of the pandemic. And so their economies open up and yet others close down. And this will continue probably until a vaccine is available and there's widespread distribution of the vaccine. And this allows consumers to restore their confidence and get on to trains, planes, and buses. The other impact that COVID-19 has had, of course, is on capacity. The ability of healthcare providers, and this image in particular is of a hospital in a particularly hard-hit destination. The other impact is on capacity. Elective procedures were absolutely stopped. The faucet, as it were turned off, so that elective procedures, which of course was the bread and butter of medical tourism in particular, and as well as health tourism, some parts of health tourism, those elective procedures were stopped. I'm a great believer in the value of medical and wellness treatments like massage therapy, for example, and I was only able to get an appointment for a massage therapy session in June. So that's an example of how capacity has been shocked, has been interrupted. Some percentage of capacity will not come back. Consumers are afraid, they're fearful. Providers need to adapt and look at other opportunities. There is definitely pent-up demand that's emerging. Some of our clients had noticed that there was a surge as soon as The ability to travel was eased. There was a surge in demand and bookings. And then when certain destinations, either their destination or the source location destination, began to impose further restrictions, there was another drop. So that's an example of this on again, off again whipsaw effect of the lack of synchronous or consistent response around the world to the pandemic. So we've got some strategic options while we're working toward the thaw. There's strategic options and there are tactical options. The strategic options are new markets, other service lines. László went through some of the wellness and more, this is what I want type of service lines, and even providers that consider themselves very serious and very focused on clinical matters. These providers should be considering extending their service lines into other areas. Then there's new source marketplaces, which is frankly local. There is local demand, which many destinations and many providers that had invested heavily in international source locations, there are local markets that need to be tapped into. And our promotions, our marketing, our communications platforms can and should be zeroed in on those new near marketplace options. And then there's tactical options. The tactical critical options are reducing and addressing consumers' fear. And that's a tricky matter. We need to demonstrate or show safety. We need to demonstrate and show that we're testing, we're masking, and we're cleaning aggressively. So this is a question about if we clean it, will they come? Just like if we build it, will they come? Certainly our hygiene standards need to be very aggressively performed and communicated. There are some credentialing and standards organizations that have added additional cleaning protocols, hotels, and we need to be doing that in our dental clinics, in our hospitals, and in our clinics' offices by showing testing, cleaning, and other behaviors that will allay and mitigate and reduce consumers' concerns. That's a joke that I'm not going to try to tackle. So what I want to do here is, nope, not that one. I want to get back to the PowerPoint. So how about the segmenting? László talked about segmenting the markets. And what I want to point out is that there are two segments going back to the way the markets break out, how the markets break down. The segments that will come back first are the vanity segments, or as László was talking about, the hedonism. I think it's an excellent, apt descriptor for that end of the market. These consumers who desperately need or want a procedure or a treatment or an opportunity to indulge themselves or to adjust their self-image somehow, these consumers will fight past whatever obstacles and whatever concerns that their family and friends have, and we'll begin to see these markets emerge. In fact, these have been the first segments of the consumer markets to emerge. The second piece that has come back are high acuity individuals with bad heart valves, individuals that seriously require cancer treatments. These individuals are seeking treatments and attempting to overcome travel barriers and access obstacles in order to access treatments. So these ends of this market array will return first. So tentatively, tactically, Think locally before you think at distance, before you think about traveling consumers. Very interesting survey data that I was reviewing recently that indicated that consumers feel safest, consumers in the United States feel safest in their cars. So I think people are going to be driving. So I think this applies to Europe as well as in Asia and other locations where it can be accessed. The services that are being sought can be accessed by automobile. Vanity and hedonism markets will come back first. Very high acuity markets will come back second. Unfortunately, that leaves out the middle market of elective scheduled procedures like orthopedics. The middle market will be the last to return. We have to address the issues of consumer hesitation by our messaging, by our protocols, and by communicating those protocols aggressively into the market segments, into the audiences we've identified. We need to look at remote solutions, telehealth, any telemetry-based or telemetry-aided tools can and should be brought to bear to help support our brands and keep our messages in front of our audiences. And then finally, we must address fear versus risk tolerance. This will be a critical element in the emergence or reemergence, the thaw of the health travel, health tourism, and the medical tourism markets. László and I are very, very happy and pleased that you've chosen to take this time to be with us. Here's our contact information. Of course, you'll all be receiving this program via email if you were able to register. Thank you very much for your patience, and I'm keen to see what questions we have.
Thank you, Irving. So let's have a look at the questions. So question one is for no one in particular. So let's start. Which country is better for healthcare?
Thanks God, Irving, you were drinking.
Well, so healthcare is an extraordinarily broad array, and I don't believe that there, I've seen thousands of hospitals and clinics, personally been in thousands around the world. I believe there's excellent healthcare everywhere. I don't believe that any one country has the exclusive, the lock on best anything. And as soon as you ask the question best, you have to ask the question, well, what do you mean? Not only what types of services, but what do you mean? So there's extraordinarily sophisticated tertiary and quaternary care available in many destinations around the world. There's extraordinarily valuable, important, and I don't want to trivialize important wellness services everywhere in the world, and countries that seem to specialize in one area don't specialize in another area. So I'm afraid that's a very wiffle waffle kind of answer, but I don't know how else to answer it. Over to you, László.
Thank you. That's kind of you. It's passing on that easy question. I think that's two things to be added here. One, unless you were looking for nothing else but a general checkup, general healthcare as such, whatever that means, may be an important factor. But in 99.98% of the time, people are looking for a certain field, a certain area, certain kind of service. And then, just echoing what Irving said, it makes a difference which field or area or specialty you're looking for. And then there can be a discussion about, is it this hospital, that surgeon, this person or that person would be better. Since don't forget, guests or patients, for that matter, interested in results, success rates, infection controls, evidence of previous interventions. In general, people don't buy healthcare unless it's the general checkup or an insurance, which is good for, and which you don't actually want to use ever. You still have it, but you don't actually want to use it, but you still buy one, insurance policy. So to take your question further, I think the country that can be good, I'm not going to mention a country, but the country that can be good is where healthcare applies an integrative healthcare approach, if you're asking me personally, where they understand that we have to cure or attend or to even to consider a certain indication or a certain state of health may be approached by 4, 5, 7 different solutions, different ways. This way, that way, and the other way, and we understand the benefits, the risks of all of those 6, 7 approaches, and we apply the best mix to you, to the given situation that you are in. Applying that kind of selection criteria, probably a less number of countries would need to look into, because not every country, even legally, would permit certain kind of interventions, certain kind of approaches are not considered to be healthcare related, may be considered as wellness. In other countries, it's considered the oldest way of looking at health. So we should have a little discussion about this, which country is the best. But if I was looking for a country in general, I would look into how they look at healthcare, how they consider health in general. And the wider they do it, personally to me, the better it sounds.
That's a terrific answer. I want to add one appendix to that, and that's that the ratings systems that are published in the press are, for the most part, beauty contests. They are an attempt by individuals, organizations to create comparative rating standards, most of which are based only on consumers' perceptions or the amount of advertising dollars spent by a destination or a provider in that publication or some other factor. So when one sees these ratings that my country is the best, my hospital is the best, look behind the curtain and look to see what the elements are in that rating system.
Thank you both for your answers. So we'll move on to the next question, which is, what mental health trends are developing in the health and wellness tourism space?
That's a lovely topic for a next webinar, I think. Mental health has already been a hot issue, especially at the European Union level, for the last 10 years, which is now obviously being seriously affected by the COVID situation. So I don't like, to the person just as a direct comment, I don't like this trend, this and trend that, because it can be very different depending on where you are, depending on the community you are in, depending on the city you're in, depending on the job you are in, depending on the life stage you are in. So the latest trend is very good for media and for social media, top 5, top 7, and top 10 trends for blah blah blah. I'm not buying that. Sorry, I'm not going to be very constructive here. But I think what's way more important is to say that, okay, I'm located here and here. I would need to look into what's relevant for me if I'm a consumer, or if I was a service provider. I would need to look into where my prospective guests may come from and what kind of issues they might have at their home destination. So in terms of trends, obviously people are more stressed. People, the divorce rate is growing post COVID because people had enough of the other, or not because they just recognize how lovely the other person actually is because finally they spend some time together. So we have either or both. We have extremes happening in many countries. So both extremes of whichever end of the mental health spectrum we are in. We have cases for both because of this unprecedented situation, and depending on your personal mental state, you may respond to it in a very different way. But certainly the media suggests that people are more into mental health, this and the other, but when you translate it into actual services or needs or wants, that becomes a very different topic. Mental health often suggests that you would need to be hospitalized because that's what mental health problems really are or could be. People don't want to be labeled of having mental health issues because that's a bad label. Even if you did, they wouldn't admit it. And it's a difficult thing to address because it's such a personal issue. Stress certainly is one, and not being surrounded by a loved one certainly is another, which is a general issue. And having a coffee over a Zoom, it's not replacing having a coffee with someone out on the terrace, however easy that may sound. So we do have some general issues, but I would suggest whoever the question was, who the person who raised the question, to look into, are you on the demand side, are you on the supply side, and look into what could be relevant to that actual segment, apart from this general being stressed and being confined and feeling overwhelmed, depending on the government as well, because some countries, the uncertainty of the situation creates the stress, and whatever you do, you can't really help with that because you're so prone to political games. So, it's not an easy question, but, well, I can't really give you an easy answer either. But segment-wise, we can find solutions, I believe.
Just before COVID, there was certainly in certain locations around the world, there was a growing recognition that behavioral health, that mental health was deserving of a greater amount of clinical attention. And there was a very tentative early emergence of telepsychiatry, the ability to provide behavioral health interventions via telemetry solutions. And in many locations around the world, these services were just emerging prior to COVID. And my firm had the opportunity to work with several of these emerging companies. With COVID now and the explosion, that's the only way to describe it, the explosion of telemetry solutions, telehealth. Here we're talking on, I don't even know what platform we're on today, but this is far more common now. And there's very good clinical evidence that telepsychiatric interventions can be effective in treating certain diagnostic categories of behavioral and mental health issues. So as these technologies emerge, and as László suggested, countries and cultures recognize and accept the need for behavioral health and break down old stereotypes about mental disease, but talk about how behaviors can be treated. I believe we're going to see a real emergence of telepsychiatry, telebehavioral health, and interventions that are more structured. And indeed, for those providers who are interested in this, this is exactly one of the areas I had in the back of my mind, thinking about you need to extend your service lines and explore other options for serving the demand in the markets that are proximate, that are closer to you?
Let me add one little point here, which is I would really warn everybody not to call mental health whatever service you are doing, unless you are a specialized mental clinic. But you might want to use terminologies like balance or rebalancing or harmony or whatever else is sufficient in the given language that you may want to communicate. Because as soon as you start to use mental health as such, many people may turn away instantly because you don't want to be labeled anyone who has mental issues. Although you need to know what the real trigger is and why people are looking for certain services or values for the matter. But how you are introducing it, how you're packaging it up, and how you like to communicate about it, I would really warn you to be careful and not let your physician to decide what should go on the website.
Well said.
Thank you for your answers. So we have a question here on the profile of a medical and health tourist during COVID. So the question is, would you like to comment on the profile of the medical health tourist during COVID?
Well, profile as in characteristics, I suppose. I was asking Irving, how would you translate that? Characteristics?
The psychological, I would go demographics and then psychological, psychographics. And I think the demographics and the psychographics, I'd refer back to the market segmentation structure that both of us used. We used different graphs, but we're basically saying the same thing, that the markets, the individuals who are interested in and motivated to consume services not nearby but farther away, the features of those people fundamentally won't change in COVID. These are individuals who are either high demand, these are individuals who are either very sick because they can't get what they want or don't think they can get what they want or what they need nearby, so they're going to go somewhere else. Or these are individuals who have a very high risk tolerance and want to get their hair transplant done somewhere else. They want to come back with a full set of hair, and they're going to do anything that they need to do in order to have that reality in their lives. So I don't think the profile, the demographic or the psychographic profile has changed because of COVID. I believe that what's happened is the externalities, the lack of access to travel, the lack of access to elective capacity. So in the example I used earlier, the individual who wants to get the hair transplant, if he or she can't find a clinic that will treat him or her, then that's a challenge to capacity. How would you address that question, László?
I think if someone had, even if it's elective, someone had a very strong need, because psychologically it can be needed, and they strongly wanted something to do, let it be a hair transplant, let it be dental, let it be some plastic surgery or some other kind of plastic surgery, the person may trade a destination in, and they might look for a domestic destination or a domestic service provider, even at a higher price probably, but wouldn't trade in the idea that I would like to have this and that done. So they may switch from one destination to another. If one destination, because anybody looking for services or treatments very likely has been doing the homework and looking at this option and that option and the fifth option, and they decided by whatever measure, and they still had the second best, third best, or fourth best option for that given treatment or service. And should the country where the first best option is located not being accessible for whatever reason, they might choose the second best or third best or fourth best option. So when you have a very deep need for something, or you really want to do something, you might change the destination, but not your mind. You don't want to change your mind in that sense. Obviously, the same can happen with wellness. If you're really missing hot springs, you may look for a different hot spring, not the one you always wanted to visit. You look for another one, even the one that you are even bored of, but still better than absolutely nothing. Or you want to have wanted to do a holistic retreat, you choose a different one because you can do yoga literally everywhere. So yes, it would be nice to do it there, but if I can't, I don't. But I still want to do it. What Irving was referring to, the middle market, which is, yeah, I would or I could do this and that, but shall I see? That market is the difficult one because they might say, you know what, I can live with whatever I have right now. I might do something in 2 years' time and next year. So that is the difficult thing. So what you can do, anyone can do, is to strengthen the need and look around domestically or look around even regionally what kind of market you can look for, because most of the time, as both medical and wellness side, except a couple of countries, everybody instantly look at international markets. This is the moment when you can't look at international markets or just select markets, not any market. So you need to reset your mind somehow what your market actually is. And you may need to reach out to different, as Irving again said earlier, different segments in terms of age. You may need to look into Generation Z. You may need to look into families, even if you never wanted to have them, but you may need to. So, you know, there are options here, obviously not as quick and not as straightforward, but you need to look at the actual motivation triggers, not how it is translated, but what really triggers. Yes. And then you have to translate the service. It's not an easy job, a task. I think, Irving, we can say that it's not an easy task to do because a lot of straightforward answers which may not work at all. That's why I referred to earlier the mentoring, that you need a bit of help, a bit of hand-holding. That, okay, this is what I would like to do, but I really don't know how to do it, especially after post-COVID. This is when you need to look for some even online help, because you can't have the real face-to-face and look for online help in terms of business development, because this is the time, because the usual tactics and the usual answers may not be useful at all.
Thank you very much for your detailed answers. The question has come from Lindy, I think, and she's actually clarified some other things. She says, the next question is, which consumer group should I target as a healthcare middleman business?
Which consumer groups should I target as the healthcare middleman?
Yes.
The easy answer to that, and I don't mean to be glib, the groups you should target are the groups that are still willing and able to move, to travel, to consume services. And as we pointed out, we believe that the first segments to move will be the cosmetic, hedonistic, wellness segments, those people that psychologically, emotionally perceive their desire very powerfully to consume these services. And the indicator for that will be those early opening, the early emergence of capacity in those areas. I made the comment about massage therapy. I think that that's an analogy around the world in different markets. So the first thing is to look around and see which capacity seems to be, which demand in which capacity areas seem to be emerging. The other side of the market is the very high acuity. So not knowing which types of consumers and which types of service lines you've been working in pre-COVID, I don't know that. I'd be happy to talk with you offline about it. But the other end of the market, the very high acuity end of the market, I believe that individuals seeking treatments for long-standing chronic diseases that are severe, cancers, blood-borne cancers, these individuals will seek treatment from the best sources available, even if that means they have to overcome travel obstacles and other types of barriers to secure those treatments. So two ends of the scale. You've got one end, which is the psychological need, and the other end, which is the medical or clinical need. Either one of those ends are the sides of the market that are likely to emerge earliest. And that every indication is that that's the way the market is indeed thawing.
Yeah, just to follow that up, I don't think being a generalist at the moment it's going to pay off.
Right.
Because the number of travelers is just such a fraction of what it used to be. So you can't have the economies of scale. So you would need to really look into in terms of what supply you have available and will be available given government regulations. And at the same time, what special niches you might be able to identify and you have access to on the demand side. And then you may find some overlapping options. And then you might say that based on the availability of supply and the accessibility of the demand, I can, as a middleman, can do up my own provision, which is not just bringing the supply and demand together, but also ensuring the prospective travelers that you know very well what the local government's healthcare, safety, security situations, regulations are, because this is the field that no one can follow, because they might change on a weekly basis of what one government expects its service providers to comply with, and no one can follow what's happening in another country. So you can find that niche, but you would need to look into at least 3 different areas, hoping that there would be some overlaps along those 3 areas. It's not going to be easy. However, you might find a person or a medical intervention or a wellness package and the matching market, and you can do relatively easily the continuous validity of your knowledge of what's happening in a given country, and you can match these parts together. It could be relatively easy, but in general, at the moment, I would do a lot of homework first and look at and collect a lot of information, and they may choose. I wouldn't do any Google AdWords at the moment, because that's just not exactly the way to go.
Thank you very much. So we have now come to the end of the webinar. We have a few questions that have not been answered yet, but we will come back to you individually on these. So thank you for your questions, and thank you all for attending today's webinar. We hope that you found it informative, and please can you take a moment to tell us how we did. You'll be sent to a screen after this with a very brief survey, and this is the only way we can learn how to improve our presentation. Thank you once again, and we look forward to seeing you all at a future program. Have a great day, everyone, and stay well. Thank you.